Good evening. I'm Julia Hastie from Rosalind Road Therapy Centre. Saopa has invited me to speak on different subjects relating to the body and mind connection. We know that the body and mind have a huge effect on our health. Our body is where we feel sickness, but how our mind deals with it can make a huge difference to the discomforts and the challenges we experience in different health scenarios. Our theme for this week is diabetes. And I thought I'd begin by saying I'm not going to differentiate between type 1 and type 2 diabetes. I'm going to speak in general about diabetes and the body and mind effects. I think that a doctor and nutritionist will go into the differences there. So there are two aspects. The first is when the person has been diagnosed, and here's the news for the first time to say you have diabetes, whether it's type 1 or type 2, it is very common for anger to come up. And in doing my research for tonight, I discovered that anger is an emotion that's very often associated with diabetes. It's an anger that feels like, why me? Why me? And a lot of illnesses will have the why me. The thing about diabetes is that it makes very big changes to one's lifestyle from the moment one's given the information, and it will be like that for the rest of your life. And that's frustrating. We like to have a feeling that we're somehow a little bit in charge of our own lives and that we can control how things happen to a degree. So a curveball like that's been told, you will never eat certain things without having to think twice again. You will change your lifestyle forever. You'll need to think about this for the rest of your life. Can bring up something in us of an anger. Why me? I don't want to. I refuse. It's not fair, and that sort of thing. So that's an important thing to know as the caregiver of someone with diabetes, because that's going to be a challenge. And we know in life that one might come to acceptance and then bump into a party or a holiday or a conversation, and suddenly that feeling comes up again. So to bear in mind that anger is a part of the diabetes journey. Another part of the diabetes journey, certainly at the start, is denial. It can't be true. There must be a mistake. I'm sure it's not serious. And then later on in the lifestyle times to say, just for today, I'm sure it'll be fine if I take a break or don't stick to the rules or don't use my medication the way we need. And diabetes is not the sort of disease where denialism is really an option. With many of the cancers have built up over 5 or 10 years, and a day or two may not make a radical difference in some of the treatments. With diabetes, every day you need to be on, you need to be awake, you need to be paying attention. Of course, fear, especially at the time of diagnosis, your whole life just changed its trajectory. You thought you were going to go this way and this is how you're going to live, and now you're going that way. And it's only natural to look to the future and think, but what if and what now? Maybe you know of someone who has had that struggle and had complications from diabetes. Excuse me. So fear for the future would definitely be a factor in the diabetic patient and their carers. How am I going to take care of this person and their diabetes for the rest of my life? And an absolute theme in all the research about mental health and diabetes is the possibility of depression. And so it's important for the caregivers, the family, the support system of the diabetic patient to be aware that diabetes often comes with the elements of depression for a person. And depression can kind of combine that feeling of why me, and this is not what I want for my life, and this is difficult and I can't keep going. And we need to be on the lookout for it. But let's assume the person's heard the diagnosis, they've gone through the different emotions, and they're now ready to face these huge lifestyle changes. certainly for both type 1 and type 2 or gestational diabetes, there are huge daily nutrition factors to be taken in consideration. But actually, the day begins for the diabetic and the diabetic journey the moment one opens one's eyes. One needs to be kind of aware. How am I feeling? The diabetic patient gets to know what their sugar levels are at, and they need to be kind of checking that, not just physically with the testing kit, but checking in with their body all the time. If this is the kind of meal I had last night, and this is the amount of insulin I used before I went to sleep, when I wake up this morning, I need to remember that. I need to be aware of that. I need to incorporate that into how I'm going to manage the first hour of my day, my next insulin, my next test, my next meal. So already in that description of the kind of relentlessness, the ongoing daily minute-by-minute experience for the diabetic patient, I think it makes sense that a diabetic patient must have various levels of support in their life. I think it's very challenging to be a diabetic patient without that. This might be in the form of fellow diabetic patients, where you can exchange advice and ideas and useful tips on how to manage the physical equipment, the testing kit, the syringes, the pills. And I'm sure in that kind of support group, there's so many small but extremely practical tips that can be shared amongst patients. But because of the amount of monitoring that's needed with the diabetic patient, there would also need to be those family members who are aware all the time of keeping an eye on the levels, keeping an eye on the level of exercise, the amount eaten, and so on. So support is both the emotional support of understanding how tiring and wearing it is, but also the practicalities. So in a family where there are huge changes to lifestyle, and I'm sure that this will come up in the other YouTubes, to have one person on a special diet and the rest of the family eating differently is quite a tough one. It's tough to ask a whole family to change their lifestyle, but it's even tougher to be the person who's alone in a family who's making the changes. And one of the things I'll be speaking about is isolation. Being a diabetic means you're a little bit on your own in a lot of different circumstances. And as the carers of diabetics, we want to be sure to keep that to the minimum. Remember, for the diabetic to arrive at a party, a picnic, an outing, a hike, a sports event means you're thinking and planning extra. Everybody arrived with their bag of the goodies they want to eat and the equipment that they need, their shoes, the ball, their sweat towel. For the diabetic, they also need to be thinking, what are my sugar levels going to be during this activity? And what about afterwards? If I need some glucose, do I have some sweeties to hand? Do I need my testing kit? Is it charged? Is it ready? So there's a lot of extra thinking that goes involved. And if the whole family or the whole group has some understanding of the disease and is on board with that, they can really make a big difference with the planning and preparing. And that becomes a practical thing. Knowing that before we go out, we need to take into consideration that we might need to stop and have a snack. And everyone else might feel like a snack just for fun. For the diabetic patient, it's a matter of maintaining their levels. It's a very critical health decision. And if the whole group, team, family is on board with that planning and preparation, that of itself is a huge amount of support. It's the one disease where I really feel where the family and community can go a long way with a little bit of education to providing extra support. So there are two aspects in the daily life of the diabetic that I've already alluded to that I think the whole group needs to be on board with. The one is testing. Yes, I said a person should check in on how they're feeling. No, checking in on how you're feeling is never going to be enough. The diabetic patient needs to be aware and physically checking their blood sugars in accordance with whatever medical protocol has been prescribed. And this is the kind of time where a person can feel isolated, where everybody else is going off to the party or the meal or the fun. The diabetic might need to stop and sit aside and quickly check. That's isolating. Or if it's a child or an uneducated group, they might want to test in front of everyone and get a lot of pushback. And people say, oh, that's gross, and doesn't it hurt? And I can't believe you need to do that, and so on. So some life skills in how to manage that kind of reaction are important. But for me, the essential is to protect people from feeling isolated, that they have to stop first and check. As you can imagine, that emotion we spoke about earlier of being in denial can kick in with testing. A person might think, I don't really need to test, because they really don't want to, and they don't want to have to go through that situation in front of everyone, and start denying that when you have diabetes, you need to be taking care of your sugar levels all the time. So that's one aspect of the testing, is to always be aware and always be dealing with it. The second aspect is the fact that if a person has a fear, and many people have a fear, say, of a needle, or have strong feelings about blood or about body parts, when that feeling of fear and anticipation and apprehension and worry and anxiety come up, our body goes into a more fearful state. The cell walls, if they see something coming to it and thinking, oh no, I don't want to do this again, I'm so sick of this, I hate this, I hate this, I hate this, the physical walls of the cell become firmer because they're trying to protect the body. The skin becomes more tense because the information the nervous system is getting is this is something stressful and dangerous and I hate. And that affects how your body receives the test. That of itself can cause a little bit of an imbalance in the sugar. So we're going to talk a bit later about a technique that I think can make a huge difference to diabetic patients. And we will be introducing the concept of meditation. And it's around, firstly, the testing. The second part of the diabetic daily journey, apart from the testing, is using medication. For some people, it means taking pills and remembering to take the pills and having a routine around the pills. And for some people, for many people, it means injecting insulin. That involves aspects of preparing the insulin, making sure it's got ice packs, making sure that needles and syringes have been properly prepared, taken along, packed. A lot of planning and thinking has gone in. And again, the daily activity of giving that injection, usually to oneself. And again, if a body is going into a state of anxiety and fear and dread, and I hate this and I hate needles, the cell walls become harder. It becomes harder work for the body to use insulin. And again, it becomes critical that we find a way of working with the mind to include diabetes, to include testing and insulin on a daily level. Now, in the past, when we spoke, for example, about cancer, what I advised, because the cancer journey can be such an all-consuming journey, is that a person take a time, at least once, but preferably twice a day, to completely step away from cancer. That's not part of the cancer. It is not part of them because the whole of them is not cancer. It's slightly different with diabetes. You can't really take a break from diabetes. You can take a rest from some of the thinking and the worrying, but with diabetes, one needs to be vigilant all the time. Now, the danger of becoming hypervigilant, meaning worrying all the time, is always present with the diabetic. Excessive worry is a very common trait in diabetic patients. Thinking, how much am I exercising? How much do I need to eat after? Is my food ready? When a diabetic patient becomes ill, particularly with something like a viral infection, it has a huge effect on their sugar levels, and it's almost impossible to predict perfectly. So that becomes a worry. In the case of the person who needs to not take a break with their mind from their diagnosis, but to calm their mind and be really, really focused a lot, to say all the time is almost impossible, is where I consider the role of meditation. People have a lot of ideas about meditation, that you make funny sounds and you go into this dreamlike state and so on. And that is not what I'm suggesting at all. In the case of meditation, where we will learn to calm the mind and become truly present and focus on what is happening here right now, can be a very powerful tool in how to deal with diabetes. And where are one's levels? Where's one's planning? Where's one's preparation? In preparing to discuss the meditation aspect, I did some research and I see there are at least 9 different kinds of meditations available. I think it's becoming a very popular practice around the world. And they range from a very spiritual kind of practice to movement, meditation, and all kinds of meditation in between. In a moment, I'm going to ask Patrick if he'd like to say something more about meditation. For myself, what I'd like to add is that almost all the kinds of meditation involve breath work and learning to control one's breathing and to manage one's breathing. And when one's managing one's breathing of its own, we often settle the mind. And remember, the mind needs to be alert and awake with diabetes, kind of all the time. It needs to be monitoring, focusing, vigilant, what is happening, what changes need to be made. Well, let's ask. Patrick, do you mind unmuting yourself and saying something more about how you see meditation? I believe you've experienced many different kinds of meditation. I've only experienced one kind, so please share with us.
Yes, thank you very much. Thank you, Julia. Experientially, I've had diabetes myself, or actually I still suffer from the permanent damages that it left me, but I did overcome diabetes through meditation and through mind power, one could say. I was basically where you are discussing now and talking about people and the stress and the fears and those kind of stuff that they go through. I was there, and at the time I was in the USA. I was a missionary, and we were basically living from day to day, and so there weren't very many responsibilities in terms of earning money and that sort of stuff. And if I wanted to get a medication, I didn't have a doctor. So we knew people, and they got a doctor, and they brought this doctor on pro bono, and he came in and he gave me a prescription for medication. And it was at that point in time that I realized, you know, this thing has got a hold of me. It's like a drug, and it's controlling my life. And it wasn't something that I enjoyed. That I didn't like that. And so I decided to beat it, to win it, you know, to take it down and overcome it. At the time, I was very strong into faith healing, and I was helping a lot of people heal themselves as well. And I thought, well, this is an opportunity now to prove to myself that it can be done, because I was basically just teaching from the writings that I'd been studying. And obviously you heal a bit of a flu here and a cold there, and maybe you got an aching bone, or you know, sprained your ankle or something, and you know, through faith you heal it almost instantly. Sometimes it takes a night or two, but no medication. But diabetes had me, and I was told that this is going to be with you forever. So obviously I made a good study of it, and there are two concepts that one needs to think of in terms of who you are. And you are who you think you are, and you are also what you eat. And this is basically the two legs upon which all healing basically takes place. And of course, on the side of how you think, it's very strongly related to fear, thought that is fear-driven, and also from a food point of view is what does that fear cause you to eat? Because eating tends to, I mean, depression for starters, it's known that people put on a tremendous amount of weight because of depression. It's a way of pacifying, it's a way of satisfying the fear that's in you. You know, while you're eating, the fear goes away and you feel at peace, and there's something that you're enjoying. And the moment you stop eating, that fear comes back and all kinds of worries and that sort of stuff, stress that goes with it. So I decided to go cold turkey, and I realized that I had to change my thoughts. And there I used a method called mindfulness. Now, mindfulness is basically where you go into a place of dissociation. Basically, you disconnect yourself from yourself, but you become the observer of who you are. So how do you do that? So who are you actually? Are you the thinker, the one that's thinking, or are you a higher spirit or a higher being that can observe and see this? Or is that higher being influenced and drawn in by the thoughts that's coming out of the thinker in your head? So what you're doing basically is you separate yourself from your mind, and you become absolutely aware of your spirit, that you are a spirit being, firstly. Once you're in that position that you can actually enter into that place, now you look down at your thinker and the person who you are, and you can now judge very, very clearly what is going on. And so you start judging your thoughts as though you were an outsider. You hear these thoughts coming into your consciousness, into your space up here, and you say, where did this come from? I didn't even realize that this stuff is hanging around down the bottom over there. And but you don't condemn yourself. You say, oh, okay, it's there. And the moment you just accept that it's there, now this could be a thought of fear. It could be a thought that is thinking of committing suicide. It's a thought of saying, I'm not worthy to be alive. I really shouldn't be living. This is a mistake. I shouldn't be here. Now these words will come up, and then you realize that those words, where did they come from? They came from pre-programming. And these words were programmed into your being, and they seem to regurgitate themselves like a fountain. They just keep coming up and up and up. And you start, what they are doing, they are like enticing you. These thoughts are enticing you to get involved with them. They want you to start wallowing in the thought of let's say, suicide, wallowing in the thought of having no worth, of just being a nothing, a nobody, when you are not, So here you are wallowing in this stuff, and what has happened is your mind has managed to capture your attention, the spirit's attention, and then it draws the spirit into it, and then the spirit and the mind become one, and they become this one massive hulk of negativity and bad thought and death to save. So how do we overcome these negative thoughts? Well, you don't really ever overcome the sprouting, because it's like a fountain, and they keep coming up, negative thoughts. But if you can learn to ignore them in mindfulness, it's basically saying, oh, okay, that thought was there, all right, just let it go. and within seconds it goes, and another one comes up, and then let's say an emotion will come up. Let's say the emotion of fear. You say, oh, there's an emotion of fear that's busy swirling up in my inner being. That's interesting. And the moment you don't allow yourself to get sucked into it, to become part of it, you have dissociated yourself from it. So basically, it's cutting yourself off from the negative energies that are within you. And it's not easy in the beginning. It takes a while. Breathing is where is a really powerful thing. Very long story short, it needs to be rhythmic. It needs to be, your breathing needs to be well-timed. It has to be like a, in 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3. It's like the waves of an ocean. It's becoming gentle. It's like a runner. It's like a long-distance runner who's pacing himself. Those beats, the beats of his feet hitting the ground, moving his arms. He's like dancing. He's in this perfect motion. His body is moving, and that's how what happens is when you get into that place where you're so focused on this breathing, you are totally distracted from everything else. The thing is, you're distracted because your mind, your brain gets so much energy from oxygen. Can you imagine? You can do without just about anything, but without air, I mean, you look at people, they get a stroke if they just without oxygen going to the brain for a few seconds. Oxygen is life. It's energy. It's what body burns to create the energy, because we are energy. And that energy comes from the oxygen that we're breathing in. So now once you start breathing in a lot more, think of this, your mind and your creative processes that are going on up here, they kind of like get a boost, and you get a bit of a high because of it. You go on an oxygen high, literally. And that high takes you up and up and up, and it takes you to a much better place where you can look down on the body, on the thoughts that are coming from the body, and you can remove yourself from it. That is mindfulness. However, there is another step beyond that, which is changing the fountain, or the source of the fountain, the thoughts that come out there. And that's a whole big study on itself. That's something completely, that'll take you weeks. It took me months to even begin to understand the concepts of how it worked and how to put it together. But what I've tried to do now is explain it in the most common everyday words that I can possibly use to explain to somebody who knows nothing about it. And I've left out tons and tons, but I've tried to just cover the top. There we go.
Wow, thanks very much. The only thing I've left to add, thank you, Patrick, is that I encounter many people who are teaching themselves to meditate, or meditating via an app or a website. And I think it might be a useful start, but from our own personal experience, is that one can gain hugely from having some sort of teacher, not just an app or a website. Yes. Because there's so many health benefits. But I would like to cycle back to the diabetic journey. Whereas different diseases affect different people at different times of the day or the week or the season or their life, the diabetic journey is one of being very alert, very aware, vigilant all the time. It requires a very particular kind of focus. Having a particular focus all the time can be very tiring, but it is critical. It's a matter of life or death. And that's why on this diabetes journey, of all the journeys, I feel that there's a huge role for something like meditation. And I strongly advise any of our viewers to learn more, ask more. Patrick and I will be available to be contacted personally. It's not a subject you can do in a quick 30-minute YouTube. It can change your life, and it will have incredible health benefits in helping one sustain being alert all the time, which is needed, without wearing oneself out. So that is thank you, Patrick.
Yes.
And that is our discussion on the body-mind connection and diabetes for this evening. And I thank you for your time.